and I will do the introduction in the beginning. We'll give people 1 minute to join. I usually start by speaking a little bit slowly. So good morning, good afternoon, good evening, everyone. Thank you for joining us today for this webinar by Dr. Micah Mazurek. But before I introduce her, I would like to remind people about the effort that we've been doing here to support families from Ukraine, family with children with autism from Ukraine, and family with typically developing children with psychiatric difficulties from Ukraine. We have been doing a series of webinars that started about 2 months ago, and we've covered a wide range of topics. And to access these webinars, please check our website. These webinars are available and people can listen to them. And we try to translate these webinars from English to Ukrainian and Russians. We've had the topics ranging from anxiety in ASD to PTSD in ASD to PTSD in typically developing children. We had a lecture on psychopharmacology and on assessment. Today's presentation is on sleep and managing sleep from a behavioral point of view, cognitive behavioral point of view in children with autism. And it's my privilege to introduce Dr. Micah Mazurek, a colleague and a collaborator from the University of Virginia. Dr. Mazurek received her bachelor's degree in psychology from Yale University and her master's and doctor's degree in clinical psychology from the University of North Carolina. She completed her predoctoral clinical internship at the University of Alabama at Birmingham and her postdoctoral fellowship at the University of Missouri. Prior to her current position at the University of Virginia, she was an associate professor at the University of Missouri and at the Thompson Center for Autism and Neurodevelopmental Disorders when she served as director of the Missouri Leadership Education in Neurodevelopmental Disabilities program. Without further ado, Dr. Mazurek.
Thank you so much. Thanks for the invitation to join today. I'm going to try to share my slides really quickly. Okay, are the slides showing?
Yes.
Great. Well, I'd like to thank you again for the invitation to join you today and to talk a little bit about sleep in children with autism. We're going to begin by learning why sleep is important, the reasons we sleep, as well as what we know about sleep in children with autism. And then I'm going to spend some time focusing on some strategies that you can employ at home to help your child get a better night's sleep. So why don't we begin by just thinking about the importance of sleep and why we're focusing on that together today. I think it's interesting to note that we spend up to a third of our lives asleep. And so the role of sleep in healthy development really can't be overstated or overestimated. Its importance is really underscored by the fact that sleep is actually the main activity of our brains in early development and among children and infants. And you can see from this graph here that shows recommended hours of sleep across time is that newborns spend about 16 out of every 24 hours per day asleep. By the age of 2, the average child has spent more time asleep than they've spent awake. And that's about 9,500 hours or about 13 months of sleep by age 2. So that's a lot of sleeping. Between the ages of 2 and 5, we know that children spend about the same amount of time asleep as awake. And even for school-age children, sleep takes up about 40% of a typical 24-hour day. So when we think about biology, sleep is a very basic and vital human need. And when we consider healthy child and youth development, it's really reasonable to assume that getting a good night's sleep plays a very important role in our health and development. And so we do know that that is the case. Sleep is essential and vital for our minds and bodies, and we can't survive without sleep. When we're actually asleep, our minds and our bodies don't turn off and they don't shut down. Instead, it's a very dynamic process, and our brains and bodies are resting, restoring, and actually processing information at night while we're asleep. So during sleep, what's happening is that our brains and bodies are restoring, strengthening, and repairing damage that might have happened during the day. And so that means that sleep is really important for health, mental health, and learning. Sleep actually helps our immune system work at its best. And I think that's important, especially during times of high stress or trauma, or during times of illness. Sleep is essential for helping us fight off those illnesses and stay healthy. And it also actually helps repair damage that might have happened during the day. For children and for adults, sleep helps with muscle repair and muscle growth. And it helps our bodies repair tissue damage from injuries or other things that might have happened during the day. Even in terms of mental health and learning, we know that sleep helps us process emotions. So during trauma or very stressful events, sleep is vital to be able to help us process those emotions at night. And it also helps us improve learning and memory. So overnight when we're asleep, we're actually transferring information from short-term memory to long-term memory. And what that does is helps us clear out unnecessary information and retain the information that's important for us to keep in mind and remember. That's going to help us have better daytime functioning, and it helps us learn over time. So we know from a lot of research that when people get a good night's sleep, they do better on tests of learning and memory than if people's sleep are disrupted. It also helps us focus attention during the day when we have a good night's sleep. So when we think about children with autism, sleep is even more important for them because we know that they face additional struggles with anxiety and stress. They also have a higher risk of medical problems and difficulties with learning. So sleep is going to play an even more important role for them to help them consolidate those memories, process stressful events that might have happened during the day, and be better equipped to function the next day during the daytime. So we've just talked about the importance of sleep and getting a good night's sleep. And we also know that if you're not getting enough sleep at night, or if your sleep is disrupted in childhood, that can have negative effects on brain development. And so we've known for a while now that reduced or disrupted sleep can affect the way the brain develops, and it makes the brain less efficient and less able to repair and rewire connections. And so what that means is if we're not getting enough sleep, we might be less resilient to stress and traumatic events. So on the other hand, if we're able to help support better sleep, it's going to help lead to better resilience during times of stress, especially. So how much sleep do children actually need? We looked at a graph earlier that shows the average amounts of sleep across time. And these are recommendations from the American Academy of Sleep Medicine. We recommend that infants between the ages of 4 and 12 months sleep between 12 and 16 hours per day, which is a lot. For toddlers between the ages of 1 and 2 years, we recommend that they receive between 11 and 14 hours of sleep per night. So about half their time is going to be spent asleep. And then around school age, we're expecting children to sleep between 9 and 12 hours. Even among teenagers, you want to see between 8 and 10 hours of sleep, even though a lot of teenagers don't get that amount of sleep. They really should. And so again, we can see here that children spend a lot of time asleep. It's very important for their brain and body development. And it's the main activity of the brain during early childhood. So it's very important for healthy development. So I want to think a little bit about what happens when we're asleep. It's not just a static shutting our brains off or shutting down. Instead, as I mentioned earlier, sleep is a very dynamic process. And we go through several different cycles or phases of sleep throughout the night. And during each of these phases, our brains and bodies are, again, restoring and processing information in different ways. So you can see here by this illustration that there are 4 primary sleep phases that we think about. And these cycles repeat about 4 to 5 times each night. So we'll go through each of these cycles 4 to 5 times. And they repeat every 90 to 120 minutes throughout the night. So the first stage or phase of sleep is pretty brief. It's really that transition from being awake to falling asleep. And it's when your brain activity starts to slow down, you start to feel drowsy, and you really begin to fall asleep. This usually takes around 5 minutes, sometimes less than that. And during this stage 1 phase, your muscles start to relax, your breathing and heart rate slows down, and your body temperature drops. And at that point, sleep starts to begin. So that's the very first sleep phase of the sleep cycle. The second stage lasts a little bit longer, between 10 to 60 minutes. And it is the first true sleep phase of the night, preparing you for deeper sleep. During this phase, it's not as easy to wake somebody up as it is during stage 1. You start to see slow eye movements underneath the eyelids. Your heartbeat and breathing continues to slow down, and your body temperature continues to drop during this stage. So that's considered to be a lighter sleep phase. And then after that stage, you start to move into what's known as deep sleep. And that is stage 3. And it lasts usually between 20 to 40 minutes. And this period of sleep is the deepest and also the most restorative. So it's a very important phase of sleep. We see very slow brain waves during this period of sleep, and your body and muscles are really starting to restore. This is when we see tissue repair and the brain begins to flush out waste. So during this sleep phase, it's the hardest to wake somebody up because they're in a very deep sleep. So after that, we move from stage 3 or deep sleep into what's called REM sleep, or rapid eye movement. And during this period of sleep, our brain is actually very active. It's the most active of all the sleep phases. And this is when dreams occur. The body is very relaxed, but it's also immobile so that we don't act out our dreams as we're dreaming them. And during this REM phase is when we believe memory consolidation and learning starts to happen. So those dreams are happening and memories are starting to come together, and we're processing information. We still have a lot to learn about dreams and why we have dreams, but there's a lot of research to suggest that dreaming actually helps our brain process memories and consolidate information that we've learned during the day. And dreams, including nightmares, can be one way that your brain helps adapt to events in your life, including stressful events. And so that is all happening during this last stage of sleep. Again, it lasts about 60 minutes and shorter periods of time earlier in the night. So just to recap, we have these sleep cycles that repeat every 90 to 120 minutes. At the end of this last cycle, we usually wake up very briefly and before falling back asleep again in stage 1. So most of us awaken around 4 times per night, but we just don't realize it. We fall back asleep pretty easily in most cases. But for some children and adults who have sleep problems, those natural night awakenings that happen every 4 to 5 hours or every 4 to 5 times each night, it's harder for them to fall back asleep if they have sleep problems like insomnia. So we'll talk a little bit about how to manage those difficulties later on, but I wanted to set the stage for understanding what a typical sleep cycle looks like for most of us. So I want to also think about some things that actually cause us to fall asleep. We've talked about the importance of sleep and sleep cycles, and now let's think about sleep regulation and how we actually fall asleep. The first way that our brains regulate sleep is what's called sleep pressure or the homeostatic drive. And essentially that's really just how sleepy you start to feel throughout the day. So as the day goes on, we all feel an increasing pressure to fall asleep. We feel sleepier and sleepier as it gets closer to nighttime. And this is caused by a gradual buildup in the brain of a neurotransmitter called adenosine. And that's released during the day, and it gradually causes more and more sleep pressure. And then at night, it reduces. So the longer you're awake, the sleepier you're going to feel throughout the day. So again, that's called the homeostatic sleep drive. The other way that our brains regulate sleep is through what's called the circadian rhythm. And some people call that the internal clock. And basically, our brains and bodies have this internal clock system that tells us when to be awake and when to be asleep. And that system is called a circadian rhythm. It operates on about a 24-hour cycle so that we know over time when it is time to be awake and when it's time to be asleep. And as part of that system, our brains produce a hormone called melatonin. And that hormone helps us know that it is time to fall asleep at night. And what's interesting is that melatonin production in the brain is triggered by changes in the light in our environment. So it starts to peak at night when darkness begins to fall, and then it drops off again when we're exposed to bright light in the morning. So if we follow our normal circadian rhythm, you can see in this graph that our sleep pressure starts to increase, and it continues to increase across the daytime. And then our circadian rhythms are triggered by that light in the morning and throughout the day. And as it begins to get dark, melatonin production is triggered. So there's this sweet spot that happens when it's time to fall asleep. And if we follow that natural circadian rhythm, we get just the right amount of sleep. Unfortunately, for most of us, a lot of things can throw that system off and throw off our circadian rhythm. So that can be things like going to bed later on some days than others, staying inside or indoors in dark spaces during the day, or being exposed to a lot of light right before bedtime. And because melatonin production is affected by light, when we don't follow this natural cycle of lightness and darkness, or if we're exposed to a lot of light at nighttime, our brain doesn't produce as much melatonin, and then that's going to make it harder for us to fall asleep at the that you're starting to feel sleepy at the right times during the night. So now I'm going to shift gears a little bit and talk about what we know about sleep in children with autism, especially. Most children with autism, between 50 and 80%, depending on the study that you're looking at, most will experience very significant sleep problems at some point in childhood. And the most common type of sleep problem that we see is called insomnia. And basically that means just having trouble falling asleep, having trouble staying asleep, or waking up a lot at night. And then overall having poor quality or restless sleep at nighttime. So that is called insomnia, and that's by far the most common sleep problem in autism. There are also other types of sleep disorders and sleep problems that occur at a higher rate in children with autism than other children. And these include sleep apnea, which involves snoring, difficulty breathing at night, and oftentimes is associated with large tonsils. Sleep movement disorders can also occur. Those are things like restless leg syndrome or moving your limbs periodically throughout the night. And then parasomnias can also occur in children with autism. And those are things like sleepwalking or having night terrors, which means the child is essentially waking up screaming or very having a terror moment, but is not conscious or aware of that. So it's not the same thing as a nightmare. So these things, again, can occur in children with autism, but by far the most common problem is insomnia. So that is what I'm going to focus on for the remainder of our talk today. So, we've done a lot of work to try to determine why children with autism are at higher risk for sleep problems than other children. And we don't have all the answers to that question yet, but we think that there's multiple factors that are coming into play. One thing that we know is that children with autism are at higher risk for many of the things that can interfere with sleep. So the first kind of part of that puzzle is neurobiological differences. So differences in the way the brain and body is developing from a biological standpoint. That includes some differences in genetics, difficulties with the circadian rhythm system in the body, and also some differences in neurotransmitter production. Just to remind you, neurotransmitters are often referred to as the body's chemical messengers. So they are molecules that are used by the brain and nervous system to send messages between neurons or from neurons to muscles. And we know that children with autism have some differences in those, including serotonin and GABA, which are also important for sleep. So this may be one reason why children with autism have some sleep difficulties at a higher rate than others. There's also some research to show that people with autism have differences in their melatonin receptors in the brain and in just being more oversensitive to stress and having a harder time deregulating arousal in times of stress. So those are some potential biological reasons. There are also medical problems that may also interfere with sleep that may affect children with autism. Those include things like side effects from medications. If children are taking lots of different medications, some of them are going to potentially interfere with sleep. Some stimulant medications make it harder to fall asleep, for example. There are also medical conditions that children may experience that can cause sleep problems. Things like seizures that could happen at night, medical problems that are painful, like gastrointestinal problems, constipation, acid reflux, those kinds of things can cause somebody to wake up at night due to pain, and then it's harder to fall asleep. Even things like eczema or other skin problems that cause itchiness, those oftentimes get worse at night. And so when children have those skin problems, it can be hard to fall asleep, or they might actually wake up due to itchiness and then have a hard time falling back to sleep. So those are some potential medical reasons why kids may have a hard time sleeping. So in those cases, and because of that, it's always very important to partner with your child's doctor so that you can work as a team to make sure that there are not any medical problems or medication side effects that are getting in the way of sleep. And you can, if those can be addressed, sometimes sleep gets better because of that. There are also other aspects of autism that can make it hard for children to sleep because of the way the differences in their brain development that make them especially sensitive to some things that affect sleep. So for example, children on the autism spectrum may be much more sensitive to sensory input like light or sound or texture. And that makes it harder for them to tune out things in the environment when it's time to fall asleep. So if there's a lot of loud noise or light or disruptions in the environment when it's time to fall asleep, kids with autism may be hypersensitive to that and may have an even harder time than other children disengaging from those sounds. They're also more likely to experience stress and anxiety than typically developing children. And so that can make it really hard for kids to wind down and settle at night when it's time to go to sleep. Some other things that we know are challenging for children with autism are communication and regulating behavior. And that can make it hard at bedtime, especially if you're needing to follow a bedtime routine or kind of regulate your own behavior to settle down. It can interfere with sleep as well. So all of these things mean that we might need to provide a lot of extra support to make it easier for children with autism to get their brains and bodies ready to go to sleep, and maybe even more support than we would for other children without autism. So today we're going to be focusing for the next bit of this talk on strategies that you could use at home to help your child or to help yourself even develop better sleep, keeping in mind what we talked about earlier in terms of sleep cycles and things that can help promote sleep. So we're going to focus on a few main topics. The first will be things that we can do during the day to promote sleep, things that we can do at night, the sleep environment, and then dealing with stressors. So all of these things can help make sure that your child's brain and body are really ready for sleep when it's time to go to sleep at night. And they can help your child know what's expected during the daytime versus what's expected at nighttime. So the first strategy really focuses on daytime, and it might seem strange to think about daytime activities when we're talking about sleep, but it turns out that what we do during the day can actually have a really big impact on sleep at night. So it's important to help children learn that daytime is the time when we're supposed to be active and alert. And the way to do that is the first step is making sure children get up at the same time each morning as much as possible. That might be especially hard if family schedules have been disrupted, but as much as possible, it's important to try to wake up at the same time each day. If you change your wake times throughout the week, that can confuse your internal clock and it can change that circadian rhythm in ways that make it harder to fall asleep at night. So having a regular wake time that's the same every day, even on the weekends, is going to be important. So the first thing is to have that wake time and then try to get your child up and out of bed and active as soon as possible. And that's going to help their brains and bodies draw the distinction between sleep time and wake time. And so what we want to do is also remember that as we talked about earlier, our brain's internal clock is very sensitive to light. So light is going to help us feel awake and alert. And that is what's going to suppress melatonin production. So first thing in the morning, we want to have as much natural light as possible. And so when it's time for your child to wake up, turn on the lights. If the child's room has a window, open the curtains right away. Try to let in as much natural light as possible. If the child's room does not have a window, that's okay. Turn on the lights. Try to just get as much light as possible in that room. There's also some things like this alarm clock that I'm showing here actually mimics natural light, and it gradually gets brighter the closer it gets to the alarm going off. So that's one way to mimic natural light if you're not able to have a window in that child's room. So, after you've gotten awake and gotten the child awake at that regular wake time, it's also important to have a consistent morning routine. And that's going to help teach your child's brain and body, again, to make that distinction between sleep time and wake time. A lot of children with autism need some extra visual cues to help them follow a morning routine. So this is just one example of just a very simple morning schedule. You can put anything on the schedule just to make it predictable. And you could use words like this one has, or pictures, or anything else that makes sense to your child. It can be something very simple, the important thing is that this tool helps the child know what to expect and to develop a consistent routine that's the same every day. So all children, and especially children with autism, really benefit from extra supports like this to help them stay on track and to know what to expect. And so that's a pretty simple way that you can do that, by posting something like this in their room. So, starting each morning the same way at the same time is going to help teach your child to begin to develop these good habits that can help them wake up. Even if your schedule is really unpredictable, you can try to keep some of these things consistent and happening at the same time each day as much as possible. So another daytime activity that you may not think about when you're thinking about sleep is physical activity. And so we know that actually physical activity during the day and exercise can be really helpful for promoting good sleep at night. It's a good idea to aim for at least 30 minutes each day if possible, and more is even better. And because natural light is so important, if you can do that while you're outside, that's even better, because you're able to get both activity and plenty of sunlight. That may not be always possible, but aiming for some physical activity, even if indoors, is going to be helpful for sleep. If you don't have a safe outdoor space for activities, there's lots of other ways to stay active, even in a small indoor space. And, depending on your child's interest and how much space you have, that could be things as simple as dancing, more active games like hide and seek or follow the leader. You could set up scavenger hunts, even in a small space, or obstacle courses where the child has some challenges that are more physical. Things like jump rope or jumping jacks or push-ups can also be ways to get active in a smaller space. But again, the idea is to have some activity and activation during the day to help your child's body, be active when it's time to be active and learn to be sleepy at night. A couple of other points to remember during the day is to try your best to make sure that your child is only using their bed for sleep. And that's going to be helpful to make sure that your child is making an association between the bed and sleeping. If the child's using the bed to do other things that are really exciting, like roughhousing or playing video games or things like that, or if they're using their bed for really stressful things like being placed in timeout or doing homework, they may start to develop negative associations between the bed that make it harder for them to relax at night. So as much as possible, try to keep a space that's only for sleep and have the child use the bed only when it's time to go to sleep. It's also important to try to think about those active, stimulating, or stressful things and activities and move those to a different part of the room or the home so that your child is not tempted to use their bed for those things. In terms of naps, if your child is a toddler or a preschooler, they may still need to have a nap during the day, and that's fine. I think it's just important to try to keep that as early in the day as possible, and to try to end the nap by 4 o'clock if possible. But for older children and teenagers and adults, napping is not great, and it's actually kind of like snacking on sleep. If we are snacking during the day, it makes us not very hungry for a meal. So if we're napping during the day, it's going to make it harder for us to fall asleep at night, and it's going to reduce that sleep pressure. And so when that happens, it's going to push your sleep schedule later, and it's going to throw off your sleep cycle. So we would recommend not encouraging naps unless your child is very young and still needs a nap as a toddler or preschooler. In terms of other things to think about during the daytime, caffeine is something else that you're going to want to avoid. Caffeine makes your body and brain feel active and awake, and it can actually stay in your system for as long as 10 hours and can get in the way of sleep several hours after you've had caffeine. So it's important to try to monitor what your child is eating and drinking during the day. We all know that caffeine is in coffee and tea, but it's also in lots of other things like soft drinks and sodas, chocolate, some ice creams and desserts, and it is also in some medications. And so you want to just check nutrition labels and make sure that there's no caffeine in places that you might not expect it to be. Children with autism may also be even more sensitive to the effects of caffeine. So it's really best to try to avoid it totally if you can, but certainly to make sure that you're not having caffeine several hours before bedtime. Okay, so we've talked about daytime activities. Now we're moving closer to bedtime. And I want you to think about that hour before bed as you're starting to get your child ready for sleep. Just like daytime activities should help your child stay active and awake, we want to think about nighttime activities that are going to help your child get ready for sleep and rest. So during that hour before bed, we want to try to avoid those active things like running or energetic play. We want to avoid heavy meals because that actually makes it harder to sleep because your body's digestion is activated. And for older children and teenagers, we want to try to do our best to avoid any arguments or stressful discussions around bedtime that are going to create anxiety and make it harder to fall asleep. So if you need to have those conversations or those stressful discussions, it's probably better to try to schedule those earlier in the day in a different location so that your child has time to deal with their emotions before it's time to unwind for bed. So the bottom line here is to try to schedule activities that are active and stimulating earlier in the day. And then we're going to want to try to avoid those activities in the hour before bed to make it more relaxing for the child. The last thing I want to emphasize here with bedtime activities is that screen time or electronic devices can actually really get in the way of sleep, both for children and for adults. And when I'm talking about screens, I'm thinking about things like smartphones, tablets, TVs, computer screens, things that are going to emit light and that you're using in a way that could be activating to you. So that light, even from devices, can suppress melatonin levels and make us less sleepy. So we want to try to avoid those at least an hour before bedtime. We also know that games like video games and exciting TV shows can also be stimulating mentally, which actually turns our brains on instead of helping them to shut down and get ready for sleep. In several of our previous studies in our lab, we've actually found that children with autism are even more affected by bedtime media use than other children. So for example, in this study that I'm showing here, we found that children with autism who use screens as part of their bedtime routine took over twice as long to fall asleep at night. In some of our other studies, children who had screens in their bedroom took longer to fall asleep, and those who watched scary or stimulating shows or games in the hour before bedtime had worse sleep. So essentially, it's best to try to remove those screens from the bedroom if you can, and to try to turn them off at least an hour before bed if possible. For a lot of children and families, that can be really hard. And if it's too hard, it's okay to start slow and gradually start to increase the time before bed. And if you just cannot remove the devices at all, I think it's one step that you could take is to turn on the nighttime mode so that you're turning the brightness level down on the device or avoiding that blue light. One thing that you definitely want to avoid is having your child fall asleep with the TV on. And that can cause problems because if children are used to having the television on or having a show on when they fall asleep, they may not be able to fall back asleep when they wake up in the night and the TV is no longer playing. So as we talked about earlier, all of us wake up several times during the night. And if children wake up and the environment is different than it was when they fell asleep, they may not have that cue for sleep that they've developed. So over time, it's really important to try to get those screens out and make sure that the TV is not playing when your child is falling asleep, if possible. All right, so now we're going to shift gears and talk a little bit about the bedtime routine. So thinking about the time about 30 minutes before going to bed, we want to try to follow the same routine every night as much as possible. And again, that's going to help train your child's brain and body to recognize that it's starting to get closer and closer to time to sleep. And that can help them develop cues along the way that can teach them good sleep habits that they can have across their lifetime. So one way to do this is to have a visual schedule similar to the morning schedule that can make it easier to know, for the child to know what to expect. And so when you're setting up a bedtime routine, be sure to choose the most active or least preferred activities first, and then gradually move towards more calming and relaxing activities. So for example, in this routine, brushing teeth is a little bit more active. So we're going to do that first. Then we're going to take a bath. That's going to be a little bit more relaxing and calming. Then read a book. We're going to have a good night hug and kiss, and then go to bed. So that's an example of a pretty simple bedtime routine that moves from more active to more calming. It doesn't have to be that schedule at all. It should be individualized to your child and family. And it's usually a great idea to, if possible, work with your child to figure out what it is that's relaxing to them. So some children like music as part of their routine. Other children enjoy a warm bath. Some like reading and some don't. So making a really personalized routine that has strategies that are relaxing for your child is going to be the most important. When we think about the sleep environment, that can also have a big impact on sleep and can make it easier or harder to fall asleep. Children with autism, as we talked about earlier, can have a lot of sensory sensitivities and can be especially sensitive to the sleep environment. So it's important to think about making an environment that's going to be helpful for them. In general, I've talked a lot about light and darkness, and during the day, we want a lot of natural light. At night, we want to make sure that the room is as dark as possible. Remember that our brains and bodies are sensitive to light. So making that bedroom environment as dark as possible is important. You can do that in a lot of ways through, shades or curtains or other things that keep out as much light as possible. Even putting towels underneath doors so that the light's not coming in under the door. Things like fans or white noise machines might be helpful for drowning out some of the background noise, because it's really hard to keep environments totally quiet, especially if kids are in a shared space or if there's a lot of noise in the environment outside. Sometimes it may be totally impossible to reduce noise or light. So other options might be helpful for your child. Things like having a sleep mask can be one way to reduce some light input, and that may take some getting used to for some children with autism, but over time it could be helpful for them. Other things like noise canceling headphones or earplugs might actually be really helpful for some kids, especially if there is a lot of noise or scary sounds happening outside. That can be one way to reduce that input at sleep. Again, you may need to gradually introduce these to your child and help them become comfortable with them, but those could be options if you can't control the sleep environment in terms of light and noise. And then, if children are needing to adjust to new sleep spaces, temporary housing, or just unfamiliar sleep environments, it's going to be even more important to provide some extra support to help them sleep. So again, as much as possible to keep things consistent, keep a consistent bedtime routine of activities, and use that consistent routine no matter where the child is sleeping. Using familiar rituals or stories or activities can help the child become more comfortable. And then just thinking about things like comforting objects, toys or plush animals, blankets or pillows that are familiar. If there's anything at all that you can keep that's comfortable and familiar, that's going to help them fall asleep a little bit easier because of that consistency. So we've talked about strategies that can be used across any bedtime routine and during any kind of daytime activities to help promote sleep. But for some children, those are not going to be enough. And so parents and professionals may need additional strategies to help with insomnia for kids with autism. So if insomnia does persist, even after you've used a lot of these sleep hygiene strategies, there are some treatments that are effective for sleep problems in children with autism. And what we think of as the first line or most effective treatments at this point, those are going to be behavioral. Behavioral interventions are things that parents can work with a therapist on. So the families work with a therapist to learn strategies they can implement, and they get additional coaching on how to do that in their homes. And these therapies can be really effective across ages, but especially for young children and for children with limited language. For older children or those who have stronger verbal abilities, cognitive behavioral therapy can actually work really well. And we'll talk about both of those kinds of strategies in just a minute. So in both of those cases, families and children work with therapists to implement those interventions. In terms of medications, I'm not going to talk about medications specifically today. As a psychologist, that's not really within my area of expertise. I will note that there's very limited evidence for sleep medications in terms of effectiveness in children. There are no currently approved medications for pediatric insomnia. So behavioral interventions are generally recommended as a first step. We do know that melatonin, which can be purchased over the counter, can be effective, and it has been the most studied in the autism research literature. There are a few side effects, and it's fairly helpful, especially in terms of falling asleep at night. So that can be an option for some families. I would recommend working with your doctor to develop a treatment plan in that case. But as I mentioned, behavioral interventions and treatments are highly recommended. So that's what I'm going to be focusing on for the next little bit. In terms of the behavioral interventions and therapies we know are effective for sleep, they all have some basic key principles that I want to talk about. And the first is the idea of having a cue for sleep. So all of us actually have certain cues for sleep that help us know that it's time to get ready for sleep. And over time, those things become linked in our brains with actually falling asleep. So when children, if children rely on external support to fall asleep, or if they need a parent to help them fall asleep, they're going to have trouble falling asleep and staying asleep without the parent there. As we talked about earlier, as part of our natural sleep cycle, nighttime waking is normal. So we all wake up really briefly a few times during the night. That can occur, between 2 to 6 times each night, and sometimes more often. And when that happens, normally, if we have a healthy sleep cycle, we just roll over and go right back to sleep. But if you've developed negative cues for sleep, you may not be able to go back to sleep. Some people, I think have a lot of different cues for sleep and favorite ways of falling asleep. Some people like to have a light on in the hallway. Other people like to have a fan or a white noise machine. Somebody might have a favorite pillow or a certain blanket. And if that's your cue for sleep, if the blanket falls off the bed at night, when you wake in the middle of the night, you might think, oh, the blanket fell off and that's what woke me up. But really, it may have fallen off a long time ago and you slept through it. And when you had your normal nighttime awakening, if the blanket's not there, you might have a hard time falling back asleep until you find it. So for some children and families, the parent has become the child's sleep cue, especially if you need to rock your child asleep or lay in the bed with your child before they're able to fall asleep. when that child wakes up in the night and you're not there, they're going to have a hard time falling back asleep because you have become the child's sleep cue. And so they really depend on you to be able to fall back asleep. So for that reason, I think it's very important in behavioral interventions that we teach children to fall asleep on their own, because that will help them develop more positive sleep cues that are within their own control, so that they're not relying on a parent to be able to fall back asleep. So the first behavioral strategy that a therapist might work with you on is called stimulus fading. And this is when many children are not able to fall asleep unless their parent is there with them. And so this strategy is going to address that problem. And so in this technique, the parent or whoever puts the child to sleep will begin the routine as usual, and will place the child in bed, sitting by their side or sitting beside the bed until the child falls asleep. And over time, the parent's going to gradually increase the distance between themselves and the child until eventually they're out of the room. And so it's a very gradual process of fading the parent out of the bedroom. During this intervention, it's important for the parent to try to limit interactions. So they're just going to stay physically near the child at first, and then gradually extend the space over time, over several days. It's important to try to minimize interaction and, not talking to the child during this time. It's just being physically present. And then after a few days, as I mentioned, you're going to gradually move yourself out of the bedroom. So again, this strategy is implemented by parents, but usually with support of a therapist to problem solve and troubleshoot any difficulties that they might encounter. Another type of behavioral intervention is going to address children who are resistant to going to bed, or also for kids who need their parents in the room to fall asleep. Some children may resist falling asleep by saying, oh, I need to give you one more hug, or I'm not tired yet, it's not time for bed, or multiple requests for getting up out of bed to get a drink or have an extra story or an extra song. So in this case, we're going to use something called a Bedtime Pass that will give the child only a limited number, maybe just one opportunity to have that extra drink or have that extra story. And so they can decide to use that, or if they don't use it, they would get a reward the next day. And so this is going to be helpful for children to learn that they can fall asleep on their own. It gives them a little bit of extra reward and positive reinforcement for staying in bed. And over time, learning to develop more positive cues for sleep without needing their parent present. So this is another strategy that's going to help with bedtime resistance. For some children, bedtime resistance is going to look like crying or disruptive behavior, and that may be the child's way of resisting bedtime or getting their parent to stay in the room with them to fall asleep. And so, as we talked about, it's important that the child learn those skills on their own so that they can fall back asleep when they need to at night when they normally wake up. So extinction is another behavioral strategy that can be used to address this. In this strategy, the parent is going to ignore those disruptive behaviors after the child is in bed and gradually fade themselves out of the bedroom, similar to the stimulus fading that we talked about. This can be hard to implement, and so for that reason, sometimes it's more helpful to be working with a therapist on implementing this for some families. So it can be very effective, but sometimes it's difficult to manage disruptive behavior of the child without a little bit of extra help. Another strategy that can also address bedtime resistance or waking up at night is to actually move the child's bedtime closer to the time that they normally are falling asleep, and then gradually move the bedtime earlier and earlier until you have it set at the time that you want it. So what that means is at first the child is not going to be getting enough sleep, but over time you're changing the bedtime to match the ideal bedtime for that child. So those are some behavioral interventions that have been shown to be effective. Again, some of these can be implemented fairly easily at home by parents, and others may be are going to require the help of a therapist. And for older children and for children with stronger verbal abilities, it may be even more important for them to learn skills themselves so that they can start to learn their own self-management strategies and learn to fall asleep themselves. Also, for a lot of children and teenagers with autism, stress and anxiety could be a big part of their sleep problem. So in these cases, a therapy that directly involves the child and helps them to learn coping skills may be the most effective. And so cognitive behavioral therapy, or CBT, is the approach that can help do that. So CBT typically involves learning about sleep and emotions, learning some new skills that the child can develop on their own, and then practicing it. All models of CBT actually work by this kind of cycle of understanding how thoughts, feelings, and behaviors are connected. And Cbt strategies work on helping somebody identify and change those connections between negative thinking patterns, unhelpful behaviors, and upsetting feelings. And so this usually involves focusing on two key areas. The first is cognitive approaches, or learning how to identify and change or let go of negative thinking patterns. And then behavioral approaches, which are going to help you learn how to change and improve unhelpful behaviors. So those are the key components of CBT strategies. There is a special kind of CBT for insomnia called CBT-I, and it has been tested, and we've been doing some work to test and develop this model for children with autism. And basically it looks like an 8-week family-based CBT intervention. Again, that includes education about sleep, teaching the child and family about sleep, developing some behavioral strategies and sleep hygiene strategies, and then a really specific emphasis on anxiety and adaptations for children with autism. So these are some example modules from the CBT treatment. Again, we're going to begin with teaching about sleep, learning good sleep hygiene routines, learning about things that we just talked about with cue control and how to develop positive cues for sleep, helping families develop better limits around bedtime, learning about the light and dark cycle, learning relaxation strategies, and then spending more time focused on those thoughts and feelings, dealing with anxiety and nighttime fears and nightmares. So again, this treatment can be very effective for older children and those who have the ability to talk and participate verbally in therapy. Some things that we've done to adjust this treatment for children with autism are increasing visual supports, giving extra time for practice, and then thinking more about how to manage sensory problems and how to make things more concrete for children with autism. Just to talk a little bit more about some components of CBT. The first kind of psychoeducational component is really focused on understanding emotions and recognizing feelings. And this can be hard for children with autism, so they may need a little bit of extra time learning how to identify emotions in themselves and others. And then the second step is to understand thoughts. So the idea behind CBT is that thoughts can influence your feelings, and people can have really different thoughts about the same situations, and that may lead to a different feeling. So in CBT, the therapist works with the child and family to start to learn how to identify their thoughts and to pick up on thoughts that might be negative to change them into more helpful thoughts. So some of those strategies can be things like learning how to recognize worried thoughts, learning how to engage in more positive coping statements or self-talk or brave thoughts, And then for some children who do a lot of worrying at nighttime, one strategy is to schedule a time during the day where they can write their worries down and talk with somebody about them, so that they can set them aside at nighttime. So that scheduled worried time can be pretty effective. Another skill building strategy in CBT is learning relaxation strategies that can be practiced and practiced right before bedtime. So some of those things are deep breathing, progressive muscle relaxation, which gradually with practice can teach the child to physically relax their body. And then some children really enjoy and respond to visualization strategies where they are imagining a scene that's calm and relaxing. And doing that right before bed can be a helpful way to turn your body off and get ready for sleep. For nightmares especially, there can be some specific strategies that are very effective, even for children who have symptoms of PTSD or trauma. And what that includes is practicing some of those relaxation strategies right before bed, and then also rewriting those dreams. And so in this kind of strategy, the child works with a therapist or their family to imagine something positive or a happy kind of dream that can replace the nightmare. And they can do that by writing it down, by talking it out, or by drawing. And just practice rehearsing that. And over time, the child begins to start to imagine a safe space for their dreams, and they can rehearse that over time. And it's been shown to be effective for children who have recurrent nightmares and kind of scary thoughts at nighttime. So I just want to wrap up by sharing some resources that are available specifically for autism and sleep that are listed here. There's a book called Solving Sleep Problems in Children with Autism that outlines a lot of these behavioral strategies that parents can implement, as well as some parent support toolkits that were developed through Autism Speaks that are available online. So I want to thank you for the opportunity, and I'm going to stop sharing my screen now.
Very good. Thank you. Thank you, Micah, for this very informative lecture. We have a series of questions, but the information that you provided is very helpful. But I want to start by getting your thoughts. How would you tailor this in a time of war or in a war zone? So, I don't know, in terms of reactions or thoughts with regard to modifying these, or what do you expect the challenges will be in a war zone, or in a time where there is no power, or in a time where are some bombings, some loud noises that you don't have control over?
I know, I think that's the biggest challenge. And some of the strategies that I mentioned of if you can find things that are going to reduce the sound, like earplugs or a face mask to try to keep things as dark and quiet as possible, would be one strategy that might be portable. Keeping the routine as consistent as possible, even things like just reading the same story or telling the same story, singing the same song, no matter where you're sleeping, is going to be helpful for the child to have some comfort and predictability. As much as possible to try to reduce those kind of external noises would be helpful. And then those relaxation strategies, so progressive muscle relaxation, deep breathing, those kinds of things right before bed can be done anywhere. So I think helping the child de-escalate no matter where they are could be helpful.
Thank you. Thank you. Something for people to be aware of is that it's expected to have sleep disturbances when you have bombs falling around you, when you have maybe tanks moving around you, trucks moving around you in the middle of the night. And during in a war zone, that's when a lot of military activity takes place, is during the night. So it's not surprising. The other thing is that it's expected to have sleep disturbances when you're moving from one place to another. One day you're in your bed, the other day you're in the hallway or in the bathroom trying to sleep or in a shelter. So it's expected, and that's why having tolerance for this is not ideal, but is part of, unfortunately, the process. As we all know, and as Dr. Mazurek mentioned, kids with autism, their sleep is very, very sensitive. So anyway, minor changes would affect grown-ups like us, and it will affect significantly more children on the spectrum. So we want to keep that in mind. Something that I'd like to share, ironically, in terms of I grew up in a war zone, and the way we were trying to avoid having sleep disturbances is, ironically, we used to sleep before the bombing will start. There was a pattern that they will bomb after 11 p.m. So the recommendation or the push is to fall asleep before then, because once you're in deep sleep, you know, a good number of people will be able to continue to sleep and not being disrupted by the bombs, whether outgoing or coming in. Very good. So let's start by identifying some questions. So how does alcohol affect sleep among individual in general and individual with autism?
That's a great question. I'm not actually aware of any research on alcohol affecting sleep and autism specifically, but in general, it's very disruptive to sleep. A lot of times people will drink alcohol because it's sort of a depressant and they think it's going to help them fall asleep, but it actually has a rebound effect. So a few hours after you go to sleep, after you've been drinking, you're more likely to wake up and have a harder time falling back asleep. So it seems counterintuitive, but alcohol can really interfere with sleep.
Yeah, I think alcohol is a sedative. So when you drink, it's like taking a sedative that's gonna disrupt your sleep. So sometimes if people, when they drink during the day, they might sleep during the day, and that's gonna disrupt their sleep at night. And in a lot of sedative, there might be some rebound effect, and that's what you might experience, on the individual might experience. Now in adolescents, and definitely in kids, but it's more relevant for adolescents, is that the brain is more sensitive during this period. So any additional medication or compounds like alcohol are going to disrupt your sleep architecture, and consequently will disrupt your sleep quality. Next question. I'm trying to figure out a little bit the question here, is that there's a concern that a child sleeping habit has changed recently. And in this situation, they were discussing about this kid who would sleep immediately after dinner. The individual acknowledged that there has been a change in the routine and going to bed early. So anyway, to rephrase the question, is that any thoughts on dealing with a change of the sleep-wake patterns?
Yeah, that can definitely happen. I think anytime our schedules change, it can disrupt that circadian rhythm. So as much as possible to try to keep the child active, keep as much light exposure as possible during the day, and even after early afternoon is going to be helpful. And then gradually moving that bedtime to the more ideal time for the child to go to bed would probably be the best strategy there. But I think changes in routines and disruptions can definitely affect when kids are falling asleep.
Yeah, and here with regard to the sleeping after dinner, while probably before it was not happening, any thoughts what could have led to this change?
That's hard to say, without knowing a little bit more about the situation and the child and family. I would just say a strategy would be to try to keep the child awake and active for longer gradually over time so that that bedtime is aligned with the previous bedtime.
Yeah, some thoughts that come to mind. Stress could lead to disruption in sleep-wake cycle. If the child has experienced recently a change in their environment, that could lead to sleep disruption. And if the kid is not sleeping well at night, then after dinner, they're going to experience that, what we call alkalosis, because I think after food, there is biological changes that will facilitate sleep. So that could be an explanation because of sleep deprivation or sleep disruption. That's why you're seeing that the kid is falling asleep immediately after dinner, especially after a good fatty meal. I think we all know that after a good fatty meal, most of us feel a little bit like tired. And if we're sleep deprived, that's when we have the tendency to take a nap.
I think that's a good point. And, for some children and adults, if they're not getting good quality sleep, even after they're asleep, if they're waking up a lot or waking up earlier than they used to, that can make them sleepier during the day. And so, like you're saying, it might make them fall asleep earlier than in the past.
Very good. Thank you. And thank you, everyone, for these questions. Next one, you can take a stab at it, and I will take a stab at it as well. Does melatonin have a side effects on children's brain?
I think I'm going to defer to you, Antonio, on that. I don't know of any evidence of that, but
yeah. So let's think of it from a short term to a long term. Something that we want to be aware of is melatonin is a hormone that already exists in the body. So theoretically, supplementing with melatonin should be okay. I wouldn't say 100% okay, but should be reasonable. However, when you supplement with external hormones, we don't know sometimes what's the origin of that compound. Is it a human melatonin? Is it a synthetic melatonin? And what are the other ingredients that are in it that could lead to some side effects? So that's in a way how we think about any external hormone. And I don't believe that what's in the pill that you're giving or the liquid or the is 100% human melatonin. So it's going to vary depending on the source. So that's in terms of as a preface. Now, when we look at the short-term side effects, as Dr. Mazurek mentioned, there's been significant number of studies that looked at the use of melatonin in children with autism and children with developmental disabilities. And from these studies, we have not seen the emergence or the identification of significant side effects. Sometimes a headache is observed. Sometimes morning tiredness is observed. But to my knowledge, melatonin, when it's used short term, has been very, very, very well tolerated. And as Dr. Mazurek mentioned, it's regularly recommended to help with the sleep-wake cycle. Now, when we start looking at the long-term effect of or side effects of melatonin, that's where we don't have much information. Most of the studies, when they used melatonin, they've prescribed it or they used it in the studies for several weeks. But as we all know, we have a lot of children with autism who have been taking melatonin for 3 months, 6 months, 1 year, 2 years, 5 years. So the long-term effect, side effects are unclear. But based on our clinical practice, on what we know, we have not read, we have not seen the reports indicating long-term side effects. Could we be wrong? Could it be possible that people are not reporting that? Yes, but clinically and based on the available knowledge, it doesn't look like there are a lot of side effects when it's used after a long term. Now, something about melatonin. While it's used to help with sleep, it's not a hypnotic, which means it's not supposed to treat sleep or sleep disturbances, but we all use it and it does help. So melatonin is indicated to help adjust the sleep-wake cycle with the daylight time and night time. That's the indication. That's what it's theoretically supposed to be used. But as we all know, we have a lot of families who are using it for sleep. It does work. It does work for a good number of kids, but we don't know if it continues to work after you use it for a long period of time. So that's why what we recommend is after 2-3 months is to stop, decrease this compound, decrease melatonin, and stop it to see if the child or the individual still needs it. Okay, next question. What could be the strategies for family to deal with the middle of the night waking up of the children and their tendency to turn on all the lights on? And this is very, the signature of kids with autism.
Yes, that can be a very difficult behavior to manage. I think our first approach is going to be to try to develop those positive cues for sleep that I talked about earlier, where helping children's brains and bodies kind of recognize the things that are going to help them fall back asleep when they naturally wake up at night. Some other strategies when that doesn't work, or if you're, in the short term, could be visual. I've had some success with visual cues in the room, near the light switches or near the problem areas that remind the child not to turn the light on or to go back to bed, that it's time to go back to bed. And then sometimes positive reinforcement strategies. So if you go back to bed in the morning, or if you've not turned the lights on in the morning, you're going to get a reward or a sticker on your sticker chart, depending on the child's level of understanding and cognitive ability. Some other short-term strategies might be to just tape the lights so that they can't be turned on easily at night. So if the room is dark, making it a little harder for the child to get the light to turn on could be something you could try.
Yeah, the sleep continuation difficulties, waking up during the night, is one of the frequent clinical questions that we deal with. Ironically, last week, I was in my clinic. I saw a patient who is in his early 20s, and mom brought up this issue. In the middle of the night, the patient will wake up and go and sleep in the mother's bedroom, in the mother's bed. And ironically, mom will go sleep in his bed. And what happens is that the kid will sleep until the morning. And if mom will have to sleep in her kid's bed until the morning. Now, when we discussed moving him back to his bed, he's a 6-foot-something kid, and you don't want to disrupt his sleep and push him to do something in the middle of the night. That's not ideal. And he has history of aggression. So anyway, it's a very challenging thing. I'm bringing up this example is because indirectly, unfortunately, we all reward some of these behaviors. So we all do wake up during the night, but most of us will turn on another side and go back and fall asleep. If we are anxious, if we have sleep disturbances, we wake up and we try to find something to do that maybe brings comfort to us. And in a lot of kids with autism, a lot of kids, the first thing that they do is heading to their parents' bed, where it's warm, cozy, and you have the parents' attention. And it takes sometimes only one incident like this or one event like this that gets rewarded, and the kid remember that, and they keep going back and they do it over and over again. So some of the things that people have recommended is actually going back, bringing the kid back and putting them in their bed, if you can do that, or if you're up for it. Because if you go have that interaction in the middle of the night, you might not be able to fall asleep after that, and you pay the price by staying up most of the night and feeling tired during the day. But so that's what something people have recommended is bringing the kids, especially little kids. You can grab them and then take them to their bed, stay next to them for a period of time until they fall asleep, to minimize rewarding them by coming to their parents' bed. Easier said than done, but that's theoretically what is being recommended at times. Very good. Next question. Screen and removing screen. Easier said than done. So any thoughts about how to manage that?
Yes, I completely agree. It's way easier said than done, even for grown-ups, to turn our screens off an hour before bed. I think, as we talked about rewarding, setting up a reward system could be helpful if kids are able to participate in that so that they're part of the solution. Helping them understand the connection between screens and sleep is going to be one way to get them to come on board with you. So I think those are a couple of strategies. Doing it gradually is probably the best approach rather than just taking it away all at once.
Thank you. Are weighted blankets helpful?
I'm not aware of any research on this topic specifically with sleep. I have heard some anecdotal reports from families and adults with autism who say that it is helpful. At this point, I think the jury's still out in terms of research evidence. Some people do like that additional sensory input, and a lot of people like just heavier blankets in general and find it more calming and comforting. So I would say that this could be more of an individualized kind of strategy to decide what's most comfortable for you or your child. Dr. Harden, are you aware of any research on that topic?
So ironically, we did the research study when I was in Pittsburgh using weighted blankets, but not to help with sleep. It was during a day program, a summer day program, where we randomized kids to weighted blanket versus non-weighted blanket. And as you expect, at the end, the findings were not clearly significant. But we know that sensory and modulating sensory input is critical for kids with autism. I think it is worth trying. If you have a weighted blanket that's available, you can afford it. So if you're looking at a small investment, I think that's very reasonable. But if it's a significant investment, the answer will be that we don't have the science to support you spending X number of money to buy a weighted blanket. But we know that sensory and weight blanket could be helpful for some kids on the spectrum. Okay. Next question, and this is translated from Ukraine. How to teach a teenager, that's the challenge, is to go to bed at, let's say, 10 o'clock. If he tells that he is not tired and does not fall asleep before 12:30 or 1 a.m.
This could be an example of using that bedtime fading strategy that I talked about earlier, where the important thing is to make sure the teenager wakes up at the time you need them to wake up each day. So getting in there, opening the curtains at 7 a.m. or whatever time they need to wake up, and then gradually moving the bedtime earlier because they're going to be tired. So typically teenagers like to stay up late and sleep late. So the first step is to wake them up early, and then over time they're going to have increased sleep pressure and actually feel sleepier when it's time to go to sleep.
That's a big challenge. Because they have the tendency to sleep in. If they, especially over the summer, if they don't have to go to school, or they have to get up and go to doing a job or doing it's very challenging. Okay. Next question. So I like these questions because they are real life questions that we deal with typically developing kids, but also with kids on the spectrum. Do you have any recommendations for waking up in the morning for an autistic child or an autistic adult?
I think, not to be too repetitive, but turning on the lights, opening the windows. If you're an autistic adult, the alarm clock that I showed that it starts to gradually emit a lot of light right before the alarm goes off has been really helpful for a lot of adults and families I've worked with, because it naturally starts to get brighter even before the alarm goes off. So those are probably going to be my top recommendations, is just to try to get as much light in there as possible so that you're more likely to wake up when that alarm does go off.
Yeah, that's a challenge. And I want to go back to what the comment that I made. We know that individuals with autism, their sleep is disrupted. The total sleep time is shorter compared to typically developing individual. So unfortunately, you have to bite the bullet and accept that Johnny's going to wake up at 4 a.m. in the morning or 5 a.m. in the morning. And this is a very common question in like clinical practice. So what we usually recommend is to make sure that they are safe in the morning when they wake up, and try to help them and reward them to stay quiet. Now, in some situation, I hate to admit that I might recommend that they pick up their iPad and they play with the iPad from, let's say, 5 a.m. until 7 a.m. when it's more reasonable to be loud. It's not easy, but that's unfortunately something that we would recommend, because kids on the spectrum, some of them, they sleep 5 hours and it's enough for them. Now, you can do that for 1 week, 2 weeks, but if you're a parent, it's very challenging. So that's why trying to treat, and sometimes, even though there are no evidence for medications, we're a little bit more aggressive with using medication, because sometimes kids get in trouble in the morning. You know, sometimes they want to eat, sometimes they open the door and they run out of the house. So that's why we have to be a little bit more aggressive with the treatment, environmental manipulation, behavioral, and sometimes medication. Very good. Last question, co-sleeping. I think we talked a little bit about that. Should I stop it or leave it in a context of a trauma after relocation?
I would say, this is, again, a very individual situation. So I would recommend, if you have a healthcare provider or therapist, to work with them on this kind of question. But in general, safety is first. So a child experiencing trauma, relocation, very stressful environments of being in a war zone, you want to make sure that child is comfortable and safe as a first priority. And so sometimes that may actually include co-sleeping for a while to help the child feel comfortable, just with the caveat that eventually you're going to have to help them learn to independently sleep back when the situation is more normal, which may be hard. But I would say emotional and physical safety is definitely the first priority.
Yeah, I agree. And I think during a wartime, war zone, and when your relocation, because of there is stuff going on, your tolerance might be a little bit higher. It is okay, because that provides some comfort to the child and help them during these difficult times. Very good. I think we are approaching the hour, the end of the presentation. I want to thank Dr. Mazurek for this informative session. I think there have been a lot of interest, as you noticed, because of the question that we have. And I want to remind people that we put in the link to the evaluation. The evaluations are very important for us because it helps us shape future presentations, the topics, the content, and tell us a little bit more about you and your reaction to the content that we've provided today. So that's one. Second is that we also have put in the link for the website where you can go and check upcoming lectures. Next week, we have a presentation by Dr. Linda Lotspeech, who will be talking about how to support parents to take care of themselves in a wartime or in a war zone, or if you are in a refugee somewhere, or if you're not in your home. Thank you, everyone. It looks like Dana want to say something.
Yeah, we have a lot of questions and a lot of comments, and I'm right now able to even read and translate from Ukrainian, and this topic is very important. And they ask, how can I teach? How can I help? What should I be doing? The child is waking up, and And I'm asking everybody to fill the questionnaire, fill the survey, and we're working on presentation on Ukrainian, okay, folks? We're working on it. I'm gonna go on Russian. Мы над ней работаем. Ребят, честно, мы переводим.
Yeah.
So,
And so, sorry, Dana, as we were talking yesterday, we're looking at people who will be willing to translate or translate actually from English to Ukrainian or from Russian to Ukrainian. I think, as we all know, everyone is busy. There are a lot of challenges, but we're looking for people so we can make these presentations available in Russian as well as in Ukrainian. Very good.
And I say again, дамы и господа, мы ищем, пожалуйста, переводчиков. Меня или Дашу в почте, в Фейсбуке найдите, напишите. Нам очень нужна ваша помощь. Пожалуйста.
Very good.
I told same on Russian.
Okay, very good. Thank you, everyone. Thank you again, Dr. Mazurek. It's been nice to see you here in this context and learning from you. Thank you, everyone, and thank you for your attendance, and see you next time.